Coming to the Knowledge Forum of JICA Ogata Sadako Research Institute for Peace and Development. My name is Masuko from the Research Institute. Prior to the opening of the Knowledge Forum, I would like to share with you some of the operational housekeeping matters. You can watch the Knowledge Forum in English, and if you wish to do so, please select the interpretation button and select the language. Also, during the panel discussion, we will be receiving questions from you. So please press the Q&A button to send your questions. You cannot use the chat box or raising your hand function. Also, we will be recording the session through Zoom, and this will be disclosed to the public. With that, we would like to begin the Knowledge Forum. First of all, Mr. Koji Makino, Deputy Director of JICA Ogata Research Institute, will give an opening remarks. This is Makino from JICA Ogata Research. We have 600 or so participants for this Knowledge Forum. Thank you all for joining us today. So now we have Dr. MABUCHI Shunsuke, the Senior Advisor, Bill and Melinda Gates Foundation. He was also the secretariat member of the Independent Panel for Pandemic Preparedness and Response. So you can see his face. He's actually joining us from Seattle. And because of the time difference, I believe it's 9:30 or 10:30 in the evening. So thank you for working so late in the evening for this forum. No issues. So at JICA Ogata Research Institute, we have been providing the most up-to-date information related to development, cooperation, and forum for rediscussion. And we have been organizing the Knowledge Forum since 2019 with the aim of providing various stakeholders in Japan abroad with the latest information. And this forum has been held since 2019, and this year's event will be the 8th of its kind. So today, the spread of the new coronavirus has had a major impact on the lives of people in developed and developing countries and on the global economy and society. The World Health Organization, WHO, and the international community's response to this threat has been reviewed over a period of about 6 months by the Independent Panel for Pandemic Preparedness and Response, and the final report has now been released. So in this Knowledge Forum, we have invited Dr. Shunsuke Mabuchi, the only member from Asia, to the Independent Panel to discuss the contents, the process of compiling the report, and the discussions on the ground, what had actually taken place at the panel, and also the reform of the international system and so forth. So we would like to engage in discussions later. So we will talk about the reforms in the international system and the future policies and projects of Japan's international cooperation. So just briefly introducing the CV for Dr. Mabuchi. Quite brilliant. A lot of wonderful the experience has had. So he used to work for JICA. So actually, I have known Dr. Mabuchi before he joined JICA. And of course, we worked together at the JICA Ogata Research Institute as well. So he was young, but like a supercar, he had a different horsepower. He came from a different dimension, let's just say. And indeed, he has continued to build a brilliant career. So right now, he serves as the senior advisor to Bill and Melinda, the foundation. So after graduating from university, he joined JICA, and then he joined McKinsey and Company, and he went on to join and work for World Bank. And so since September of 2018, he has been working for the foundation. So he has also acquired the doctorate for public health. So today's program will last about 60 minutes or so. So about just short of 30 minutes or so, Dr. Mabuchi will share with us his keynote speech. So it is entitled Making COVID-19 the Last Pandemic, Analysis and Recommendations by the Independent Panel for Preparedness and Response. So that will be about half an hour. And the remainder, we would have a talk session for 15 minutes. So we have Ms. Makimoto, the Principal Research Fellow from JICA Ogata Research Institute. She has been engaged in COVID-19 related initiatives. So we would engage in talk session for 15 minutes. And the remainder 15 minutes, we would like to open the floor for Q&A. So, of course, we may not be able to reach all 600 of you, but we'd like to pick up as many questions as possible. So please make use of the Q&A function on Zoom. So if you enter your question there, we will read those out and address those to Dr. Mabuchi. So Dr. Mabuchi, please. This is Mabuchi. Thank you very much for joining us today. So I'd like to share the screen. Can you see this? Yes, we can see it. So let us talk about, first of all, the COVID situation. As you know, about 200 million of people have been infected. We have more than close to 4 million deaths because of the pandemic. And we still haven't seen signs of subsiding. So depending on the season, we will bound to see the pandemic ups and downs. So it is called endemic in terms of its situation. So we will need to have vaccination every year going forward. So two simple questions we have. Why are we experiencing this? And what would be the lessons for the future? How can we prevent the recurrence of this pandemic? So for those two questions, in order to address this from an independent position, there has been a request to engage and establish a panel. And the public health institutions, about 12 months ago, requested WHO to initiate such an independent panel. So the director, the general, he had engaged the Right Honorable Helen Clark, the former Prime Minister of New Zealand, and also Her Excellency Ellen Johnson Sirleaf. She actually been awarded with a Nobel Prize laureate, and she was also the president for Liberia. So these two women have been the co-chairs of this panel. So from an independent position, they have initiated the panel, and they have selected 11 of these experts to launch this panel. So we have the former president of Mexico or Colombia, for instance, Minister of Colombia and so forth. So HIV, AIDS, malaria, and also tuberculosis, and also some of the heads who had headed the research institutes. And also we had the former global CEO of the Médecins Sans Frontières, and also some of the rising leader, the young leaders, have also formulated the panel as well. Also, the panel, of course, these experts have been selected alongside with the secretariat staff, who were formulated and responsible for drawing of the report. So I was selected as one of the secretariat staff, and we had engaged in this task for 8 months or so. So initially, I was engaged as a team leader for 3 different projects, but I was in the end given the responsibility to compile the final report for the panel. So the recommendations is actually formulated in this form of the report. So we have the main report on the left, and also we have the summary. And also what we see in the middle is we have 14 defining moments have been outlined in how an outbreak became a pandemic report. Also, we have 14 or so background paper were also published. All these are available through the website. So in terms of the background paper, it outlines how since the COVID-19 has been detected, and also give a chronology of what has actually happened, and also analyze 28 countries and categorize them into who did well as opposed to who did not. So they conduct a fairly interesting analysis. So first of all, why has COVID-19 become such a widespread pandemic? So I'd like to share with you some of the key feelings identified. So in terms of the pandemic side, we have the preparedness, and also we have the detection alert. So WHO detects it and gives alert to the world that the pandemic will become a severe pandemic. And also there will be an early response on the part of the countries, and there will be a scaled response. So this is more of a cycle that we see in the pandemic. But in all the phases, we have seen failures one after another. And if we have been able to engage in a much better manner, we would have been able to prevent it.
And first of all, in the prepared stage, as you know, most of the countries were not prepared for a pandemic. The emergency systems and institutions is one, but to begin with, the financing was inadequate to prepare for a pandemic, and there was no incentives for it. The second is about detection. On the 24th of December in 2019, one doctor in China found that now there is a spread of the infectious disease which withstands the normal therapeutics and the medicines against the respiratory diseases. And then on December 30th, there was a report to the WHO, and the WHO began the investigation. So one question is that why we were not able to find it out before December 31st. And so that is why we have seen this situation, which has continued this day. So the surveillance of animals and the surveillance of the sewage water and the surveillance of environment, if those surveillances have been being thorough, then we might have prevented it from happening. And after receiving the report, the WHO took 1 month before sending out alert at the end of January. So there was a delay in the sending out the alert, and there was a delay in the investigation, and there was a delay in the decision making in issuing the final alert. So there were a series of delays that is related to the mandates, the authority of the WHO and others. And so on January 30th, there was an alert issued by the WHO, and February was called by the panel as a lost February. If you see the analysis of most of the countries just waited and saw. And only after they saw the introduction of the virus into their own territories did they begin the responses. And so the speed of the spread of the virus was 5 times or 10 times more, and the pandemic then occurred in March. And let's move on to number 5. So behind this series of failures is, first of all, the pandemic was not seen as a top global threat for the national security or the global community. And because of that, WHO, for example, was not empowered to lead the nation states, or each government did not have sufficient investments for preparedness, and there was a very slow response to the alert. So what should have been done? In the panel, there is a set of 8 recommendations issued by the panel. So I'm going to talk about 7 of them. But there is an overlap between the two, so I have compiled them into 6 issues. First is what I've just told you, the pandemic threat was not seen as it should have been. For example, the threat of the nuclear threat or the threat of climate change. So one of the recommendations is to raise the level of the recognition of the threat of pandemic on the global level. So 3 heads of state should co-chair the Global Health Council. That is one of the recommendations by the panel. And this council would work to implement these recommendations or monitor the implementation status in each country, or to be responsible for financial contributions by the states, and also will be working on as a coordinator of the negotiations surrounding the financing. Second pillar is the reform of WHO. As you may know, WHO depends on the voluntary contributions, financial contributions by the donors. So where the money gathers, then that is where the WHO works. And the technical guidance or the development of the guidelines or the advisory work in terms of the infectious diseases, which should be the core work of the WHO, has not been conducted fully. And the WHO is also engaged in the supply of goods, but they don't have the comparative advantage. So they should focus their efforts on what they are the best. That is to provide the technical advice, expertise. And next is related to the independence of WHO. I already mentioned that there was a delay before WHO issuing the alert after receiving the information, because WHO is dependent on the finances from the countries. That means that the WHO finds it very difficult to have a very firm stance against those donor countries. And also the Director General is elected by the election from among the member countries. So the current Director General will move towards his or her re-election. So this is a structural issue surrounding the leadership, and this issue must be dealt with. First of all, about the financing issue, and the voluntary contribution should be made to 0. And depending on the economic situation of each country, they should provide the financing to the WHO in accordance with their economic might, so that financial independence can be achieved. And also the re-election of Director General should be abolished, so that there will be only a single term for Director General. And in order to prepare for future pandemics, there are other recommendations. Based on the current experience, all countries must review their and update their plan for the preparedness. And to be more specific, based on the analysis of the 28 countries, there are different kinds of recommendations. One example is a pandemic coordinator will be appointed by the heads of state. And this coordinator will coordinate between the local governments and the national government, so that the countries can have a whole of a government approach to the pandemic and infectious diseases. And the coordinator should be empowered to do that. And so this is one of the recommendations. And in addition to that, the incentives, the countries should be incentivized to update their preparedness plan, and also in order to raise the level of the leadership in terms of the health issues, IMF should, in relation to the macroeconomic risk analysis, there is a formal process of consultation with the member countries. And the analysis of the pandemic preparedness should also be included in that consultations so that the preparedness against the pandemics should be elevated in terms of the level of the government approach, so that the preparedness should be made thorough, or also the raise the level of the preparedness work within the government. And detecting the disease and issuing an alert, and this process should be more speedy, and so that we can catch up with the spread of the disease. So the animal surveillance and the environmental surveillance and different surveillance systems should be effectively used, and also the different surveillance systems should be linked through the digital technologies. Also, and this is related to the delays in action by the WHO, for example, the IAEA, in terms of nuclear power, when there is a risk of nuclear power, they are empowered to do the on-the-spot investigation without prior notice to the country. So in a similar way, when there is a risk of a pandemic, then they can send the investigative missions without prior agreement of the country. And such strong empowerment is needed for the WHO, although it is very difficult issues in terms of the sovereignty issue. However, if the pandemic threat is seen as serious as the nuclear threat, then that kind of action should be taken. And this graph shows the international comparison of vaccinations of some countries, United Kingdom, Israel, and the US. These countries have already achieved 60%, more or less 60% of the first vaccination completion, and also high level of achievement of the second vaccination, whereas Africa, it's only 1.45% of those who have completed one dose, and for those who completed the second doses, it's only 1%.
So this is indeed inequality in terms of vaccine. And of course, we're seeing the third wave of the pandemic in the developing countries, inclusive of Africa. And of course, if it continues to do so, we will see more new variants, which would actually come back to the developed countries as well. So when we talk about the pandemic measures on a global basis, this is definitely not an effective response. So we should not see the recurrence of this happening. But of course, this is a fairly complicated issue. So to make the story more simple, when we talk about the developed countries especially, so we would have a pool of funds from those developed countries ahead of time. And if there's a risk of infectious disease, then the specified organization would actually invest at the phase of research and development. And at the time, they would negotiate before the pandemic's occurrence. They would negotiate with the pharmaceutical companies to secure the vaccines, and the technology transfer would occur to the developing countries. So there will be licensing. So the production could be conducted in the developing countries as well. So all these arrangements need to be conducted beforehand in order to prevent the inequality that we are seeing today. Also, in the mid to long-term basis, in these countries, we have a fairly limited access, a limited production amongst the different countries. So we need to rectify the situation. So we need to have a hub where we could have regional production. So this is more of a mid to long-term proposal that we have. Finally, this relates to the financing. So when we talk about the response for COVID-19, the obvious gap exists in two areas. First of all, this is investment related to preparedness. This was overwhelmingly in shortage. And also another point, at the time of emergency response, there was not an agile flow of funds. So for the developed countries, it really relates to how they can actually coordinate that within the budget. But as far as the developing countries is concerned, they don't have the budget to start off with. Therefore, we need to have the funds available from the international community so that they can be supplied with those funds. So new types of financing facility needs to be established. So we have US 5 to 10 billion yen per year, preferably from non-ODA budget lines. And that is the contribution we recommend. So that could be used for preparedness for the developing countries. So those are the overall recommendations that the panel has actually put forth in order to make it the last pandemic. So the important point is we cannot engage in just one or two recommendations. That in itself will not prevent the pandemic. So right from the start, from the preparedness, all the way to detection, to alert, and the agile response by the countries, and all have a scaled response. So we need to have an end-to-end reform. Otherwise, we will not be able to address the next round of pandemic. That is an important point. Also, another question is how feasible is this, are these recommendations, and who would actually implement these recommendations? That is the second question. It really depends on the decision-making process and also the negotiation process of the respective countries. So first of all, on the right-hand side, just to look at the chronology. So the report was published in May of this year, and WHA, that is World Health Assembly. So it has been discussed at the General Assembly of WHA and also at the G7 summit. So there has been consensus and approval for the recommendations of the panel. However, no concrete decision-making has been made already. So this year will be a decisive year in order to address this. So first is the September, the UN General Assembly, and also G20 in October of this year. Those are the two key stages. And we are also having a report in July of this year, and I'm involved in the presentation of this, the panel report from the Bill and Gates Foundation. So the question is, how is the global community going to make the decision? So those are important steps and important decisions to be made for this year. So finally, as the secretariat staff, we have supported the independent panel. So this is a group photo, not everyone, but almost all of them, the group photos from the secretariat. So we are back to our own fields, and we will continue to engage in various countermeasures and response against COVID-19. I myself, I'm back at the Bill and Melinda Foundation, Gates Foundation. So we are trying to disseminate the vaccine at the earliest phase possible. That is one task that I'm involved in. And also, subsequent to that, the global health security governance and establishment of their framework. I continue to follow up on those initiatives as well. So I would like to continuously engage in these efforts. So that is all from my end. Thank you very much for listening. Thank you very much, Dr. Mabuchi. So we'd like to move on to the talk session. The moderator would be Mr. Makino, the Deputy Director of JICA Ogata Research Institute. So joined by Dr. Mabuchi, we also have Ms. Asaida Makimoto, Principal Research Fellow, JICA Ogata Research Institute as well. So the talk session will be 15 minutes, and there will be a Q&A session for 15 minutes as well. So if you have any questions, please press on the Q&A button. So this is Makimoto from JICA Ogata Research Institute. First of all, Dr. Mabuchi, thank you very much for such an insightful and a valuable presentation, quite comprehensive and quite significant in terms of the content of the proposal. Thank you for sharing those with us. So it is quite a full-fledged long report, so maybe some of you may not have been able to read through them, but I think this presentation will definitely stir you to read through them. It is quite interesting. So first of all, as you rightly mentioned in the beginning, so you were the only secretary staff from Asia to participate in this process. So what were some of the challenges you faced? And was there a significance that the only Asian joining the panel? Did you have any insights from those? When we consider the response from the global community, perhaps the average, the response level, let's just say the level has been one of the most satisfactory from Asian countries. But actually, as one of the panel is seen as the Dr. Fauch from China, we have one individual as part of the experts, and he was able to provide us with information from China. So himself and myself, so only 2 Asians were involved in the panel. So the fact that we have 2 participants from Asia and convey the information accordingly, that is very valuable. But of course, that brings to the point, how come Asians are hardly ever invited into these panels? That begs a question. So at this kind of venue where the information will be disseminated, the fact that Asians perhaps were not really prevalent in those venues in the past. So the fact that I was able to participate and was involved in the compiling of the main report, I think in itself was quite significant as a milestone. But I myself, as amongst the panel members, I struggled through the discussion. And we have some people who have some brilliant vision, or we had some the members who had a really balanced vision. And of course, some people had this really hollow that you would just listen to him or her, whatever she said. So we had seen various styles of leadership. I was able to witness that firsthand in the panel. But let's just say the Asians, for us to really exert leadership in that sort of setting is important. Of course, we may need to adopt some Western style of leadership as well. So those were some of the findings personally. Thank you very much for that. So Taiwan, Singapore, and Asia, and Vietnam. So of course, various experience have been shared. So when we share those, it is important that we convey the Asian perspective, which may be different from the Western perspective. So thank you very much for becoming that individual to do that. So also the last slide you have shown in the presentation. So you talked about, these are some of the questions that we are receiving related to the last slide of our presentation. So after launching the report, there was a World Health Assembly, there was G7. So already various leaders have conducted discussion based on this report, or there will be a venue to conduct discussions. So what would be the possible response we may receive from those leaders? And also amongst the recommendations, what would be positively accepted? Or what would be somewhat more challenging to be accepted? So those were questions that we received already.
Okay, so about the responses, of course, we will still have to see what kind of responses will come. At first, in general, so most of the positive feedback were, yes, we are supporting these very ambitious reforms. However, when it comes to very specific recommendation for reform, there has not been any voice supporting such actions, and that is something of a concern. For example, at the General Assembly level or G20 level, we recommended the Council to coordinate all these actions against the pandemic. Although we have a very general support, however, there are very difficult hurdles that we have to overcome, and how each country displays its leadership so that we can achieve this. We still don't know how this can be done. And the same thing can be said with the financing. So financing of large scales should come from especially from the developed countries, depending on the country's economic situation. That is the recommendation by the panel. But because of the situation of each country's budgetary situation, we don't know how that can be achieved. And the leaders of a nation should expressly support this kind of initiative. Otherwise, concrete action will not start. In terms of a pandemic, WHO pandemic treaty has been proposed by the WHO, and there is a certain progress. However, when it comes to the independence and the authority of WHO, there should be a solid, concrete content. Otherwise, it will be meaningless to have such a treaty. So to what extent such points can be concretized, we will still have to see. But the U.S. government and other governments are quite positive in discussing these issues. And personally speaking, I hope to see a very ambitious and bold decision-making by the governments. Thank you very much. So these are all challenging, and they all take time in realizing. So they are not simple. However, we have received positive responses from the governments, which is encouraging to us too. Yes, that's right. Makino-san. So Makino-san too have been engaged in the work of the reform of international systems. So based on your experience, do you have questions to Mr. Mabuchi? Yes, that's one thing that I would like to talk about, but there is also another point that I would like to raise from a different perspective. First is that it's not related to such a big scale system building, but international aid architecture, the new architecture building is something that I have worked on. And at that time, the Japanese government and JICA and in Busan in Korea, there is this event. So the Korean government was also involved. So with these three countries and the U.S. government involved, these three governments worked on that. But we still had some very big issue left out. So the UN General Assembly is one key decision-making forum. But you mentioned your hope about the U.S. government action. But so what is the main engine in all of this? I don't know about that. The U.S. government says only they will consider this, and it's not that they are going to become a main engine. And as we take on the reform, which goes beyond WHO, so which country, who takes the initiative as a main engine? And also this recommendation of a council, Ellen Johnson Sirleaf, is a co-chair because probably the Liberia had this experience of Ebola outbreak, and both you and I were involved in the work in terms of the Ebola outbreak, and we all were there in West Africa. But one question we faced at that time is that the health Ministry of Liberia, which was not so strong. So maybe that's one of the reasons why there were very active involvement of communities. For example, in one village, couple of volunteers were solicited, and they were engaged in the educational activities in partnership with the government. In terms of the COVID-19, this type of bottom-up approach, I did not see very much. And the panel recommendations also sound like a top-down approach rather than the bottom-up approach. But I wonder if that is the way it should be. In Japan, the people are criticizing the government. However, I think that there should be some other moves from the bottom up coming from the local communities. So the human security needs two approaches, both top-down and bottom approach. I think this is a very important point, and I would like to know whether there was any kind of discussion on this in the panel or what you think of it. Thank you for a very good question. The first question is a very difficult one. I personally would like to expect the G20 to play a role. This IPPPR is an independent panel, but separate from that, a G20 high-level panel has been established, and they are working on the recommendations, and the CEO from the Gates Foundation is also a member of that panel, and with excellent panel members. The secretariat said that they read all the reports coming from IPPPR, and so based on that, the G20, I hope, will come up with the very good recommendations which will fit into the G20 meeting, and I hope that this will be main driver. G20 includes different kinds of governments, but including the U.S. government. So I hope that the G20 will play a role. As for the second question, to put it simply, I think we need two approaches. When I was working with the World Bank, I was a team leader of the team leader that worked on the Ebola outbreak in West Africa. But there was a very strong leadership coming from Liberia. Ellen Johnson Sirleaf recruited the 40 very good young leaders who were engaged in this responses to the Ebola outbreak. And they realized that the community cooperation, community surveillance were indispensable in order to put an end to the Ebola outbreak. That is why they put focus on strengthening the community work. And through the coordination with the community workers, they were engaged in the Ebola outbreak responses. And that system was used as the starting point in order to respond to the coronavirus. Sierra Leone was similar. Someone who was in the United States was brought in to respond to this crisis, and a lot of different leaders were put together to cope with it. So there were top-down and bottom-up approaches, two approaches. And in the COVID-19 too, there are actually two approaches, especially with Asian countries. Top-down approach about the management was very good, but there was also a bottom approach, especially in South Asia. The communities were the main basis for the responses. When you compare the failures and successes, the leadership roles are quite clear, and this was well reflected in the report of the IPPPR.
Thank you very much for that. So you mentioned top-down as well as bottom-out. Those are important. So of course, human security is the main initiative taken by JICA. So in Asia, those initiatives were quite strong. So again, we come to an understanding that human security should be further promoted in Asia. So thank you very much for that very valuable information. So we only have 15 minutes or so. So time flies, and it is quite limited, unfortunately. So we have 24 questions already. So thank you for the questions. So these are the questions. So we'd like to pick up some of those questions for you. So you've talked about your experience with Ebola epidemic in Liberia. So when you talk about WHO reform, actually reform has been conducted after the Ebola epidemic. So what were some of the lessons, and were the reforms really progressing or not? So I think the challenges you've already shared with us when you're in your previous mark, but what were some of the lessons you had from Ebola epidemic? So the WHO, after Ebola epidemic, one of the major initiatives were the reform, and what has been implemented already is the emergency program. So they would establish a separate emergency program and emergency force. And for COVID-19 response, that particular the entity was responsible for engaging in the initial initiatives. So that was positive. But of course, we are facing other challenges as well. As I have mentioned in my presentation, when we are to make those decision makings, there is an issue related to independence. Also, in terms of the mechanism of surveillance, we need to have much more detailed and deep dive. So not just humans, but also we need to have surveillance on animals and environment as well. So there are many issues that we are facing. And for those issues, perhaps we have not been able to engage in full-fledged reform. So this time around, with COVID pandemic, we have made specific recommendations. So the decision-making will be conducted at WHA, the World Health Assembly. So at the level of WHA, clearly, there would be a definite response and answer vis-a-vis the recommendations. So we are hoping that we could have a clear answer from WHA. And based on that, WHO could engage in the full-fledged reform. That is our hope. But it really depends on how the situation may pan out going forward.
Thank you. The next question is, also about the WHO reform. There's another question. In order to strengthen the functions of the WHO, in order to do that, the financing and the authorities and independence will be needed, but that there is a fear that WHO will become too large as an organization. So in terms of how we streamline the functions of the WHO, is it something that was discussed in the IPPPR? Yes, that's a very important question. So the organization becoming too large is something that we must avoid. So the panel recommendation is that the WHO should focus on its core mandate to provide the expert technical advice and also developing strategies and policies. And this part should be strengthened. And in that process, there was a discussion that, not only that we should focus on this, but also you should decide which areas you will no longer focus on in terms of the response to the coronavirus. PE and the masks and the essential supplies and the procurement of such essential supplies, the WHO took the leadership in such procurement. But that is not where the WHO had the experience nor the competitive advantage. So that is why there were delays in the decisions and other problems. So that is one of the areas, for example, that a WHO should not focus on. And the country trial received a positive response, but the authorization of vaccine is also done by the WHO. So that means the WHO has a conflict of interest. So rather, the WHO should focus on the technical proposals or come up with a global strategy to use the vaccines for coronavirus, for example. That is the area that the WHO should focus on. That is the proposal from the IPPPR, and I hope that these recommendations are actually incorporated into the reform of the WHO. The voluntary contribution means that depending on the will of the donors, the WHO conducts this and that should not be the way it should be. So that means that the stable financial basis should be established so that the WHO can really focus on its core emissions. And that is related to the independence of the organization. So all these must be tackled in a comprehensive manner in order to advance the reform.
Thank you very much. Next question relates to the vaccination. So you've shown us the chart already. That was quite impressive and easy to understand. So why the vaccination in Africa? How come it is so delayed as we have seen? And how can we address and rectify the situation? That was another question raised. So the vaccine summit has been hosted, and actually Japan has co-hosted the conference. So 30% of the population coverage has been ensured. But in terms of visibility into the future, I believe you're conducting some recommendations. So if you can address this question as well. Thank you very much for that. The first point I'd like to mention, as I have touched upon slightly, so the developed countries or the high-income countries, so as they fight over the vaccines, so the developing countries, obviously they are lagging behind because financially they cannot commit to purchase a large amount of vaccines. So Mac asked VETA or COVAX, this is a global mechanism, in order to support these developing countries. So we would pool the funds, and they would have the negotiated power to source the vaccines for developing countries. And so based on that procurement, they would distribute those to respective countries on an end-to-end basis. So of course, when this organization was launched was only slightly after the outbreak. So now we have more funds being gathered, inclusive of Japan. So some of the commitment has been established already. As we speak right now, the commitment has been realized. So if we are going to address the inequality issue, we should have conducted this right from the start. For instance, March 2020, we would have the funds and COVAX mechanism, if it had already been there, and if they had a predetermined negotiation with the pharmaceutical companies, and if they were able to invest a large amount in R&D, and then they could have been able to secure a lot of vaccines for the developing countries. So now, because there are some issues related to supplies, so once we have that response and preparedness, in place, then we should be able to address this inequality issue. And I think that is the direction we should strive towards. Another point to mention, to procure it on a global basis and distribute, that's always challenging. Because if you pull it in one area, and in order to distribute it to across the board of all the countries, that is very difficult. That is why we need to have regional initiatives. So because Africa was very much frustrated with the slow pace and the global the supply, and that is why they are establishing their regional initiative. So the question is, how can we support those regional initiatives? And we are starting to see that in Asia as well. So together, from the global framework as opposed to regional framework, by having this coordination, we should be able to have a much more effective measures.
In Asia, WHO's UPSEDO is the framework. And originally, there was such a mechanism of response to in Asia Pacific, but there is a need for strengthening such mechanism in terms of vaccines. Right, yes. We have only a few minutes left, so we will take up the last two questions then. Response to pandemic and preparedness. And now, at the level of the heads of states, those two issues are now being realized, and now the new mechanism is being realized, and with the pandemic being focused on SDGs and the human security, and all these concepts might be left behind. That is one fear, and in order to prevent that from happening, what is needed? Thank you. That's a very important point. I'd like to say two things. One is the WHO funds, the ODA framework. If the funds come from the ODA frameworks, ODA lines, then unless the ODA fund itself is significantly increased, the ODA funds will be diminished, and that is I'm personally afraid of. So pandemic is a question of security, global security. So there should be funds distribution, budgetary distribution beyond the ODA. I believe that the United States has allocated budget for pandemic in the security budget lines. So the investment in public goods should be mobilized from non-ODA lines. That is one point. And the second is the strengthening of the international health systems. And the preparedness for a pandemic have come across in certain areas. The World Bank and JICA and other institutions have conducted the different financing or the cooperation in terms of strengthening the health systems. Then how can we incorporate the public health into it? And the role of public health institutions should be strengthened. And what kind of role? How we can strengthen their roles in the peacetime? And of course, it's not just the pandemics and the infectious diseases, but the other diseases that these institutions should play. For example, how we can build a system to incorporate in that health system the pandemic surveillance, so that from the perspective of resilience, how can we reform the financing for health systems? And how can we rather increase the quality of the existing health work, but at the same time engaged in the preparedness for an infectious disease or pandemic? We have to approach from these two aspects. Otherwise, we will be, the same size of the pie will be distributed among different areas. Thank you very much. Yes, thank you very much for your advice.
Unfortunately, our time is up, and we have received many questions, and it's very regretful that we cannot answer all of them. The last question, this is from a Japanese student. Many students from Japan are participating in this forum, and they have ambition to be like Dr. Mabuchi, to go out into the world to work for international organizations. So as career paths, what are some of the initiatives? What are some of the areas of study that they need to focus on? If you can share with them your insights, that would be helpful. Thank you for that. I do make this comment quite often, just to simplify what Japanese people are, or how we are. So we do have a number of features where we have the potential to engage in very important jobs. So for instance, we're capable of conducting project management and deliver the outcome. And also, what is most important is the fact that we need to understand the emotions and also the relationship of the decision-making people and the leaders. We are capable of assist in the leaders making those decisions. So rather than engaging just in reason and logic, that would not be suffice to address and approach the leaders, not just for developing countries, but also on the global basis. I think that is a very important skill. Of course, that may be too simplified, but I think Japanese people, our skills in that sense has been honed on a day-to-day basis. And of course, but in order to leverage on that, we still need to know how to engage in discussions and how to take leadership in the Western manner. And how you can really learn those skills, you really have to be there in the field. It took me a while to be able to conduct my work in English. So it's been close to 20 years since I have come out in the world. So now I don't have much of a difficulty in terms of engaging in discussions with English. However, on a daily basis, I'm still engaging and enhancing my skills to discuss in the Western manner. And so there was a certain time in my life that it became easier for me to take leadership and also lead the team members. So that is after engaging in very difficult work. So for instance, I worked for McKinsey & Company in the past. And this is indeed an organization where very talented and smart people are gathered, and they're working together to solve different projects and solve issues. So I was actually engaged in the overseas office, and it was very challenging for me. But because of going through that experience, I was able to really acquire the skill. And upon acquiring that skill, I was able to leverage on my own sort of Japanese characteristics. So you need to have both skills. So you need to combine, and you need to strike the right balance between the Japanese skills as opposed to the Western skills. And that's exactly what Ms. Sadako Ogata has been doing. So that is the kind of model that I have been striving to achieve, and let us work together to achieve the mission and goal of Ogata Sadako. Thank you very much for that very insightful comment, and we look forward to your further cooperation and insights. Thank you very much. So thank you all for your questions. Unfortunately, because of time limitation, with that, we would like to close the Knowledge Forum of JICA Ogata Sadako Research Institute. Please give a round of applause to Dr. Mabuchi, please. And those of you who have participated in the Knowledge Forum, we would kindly ask you to fill in the questionnaire. It would only take a short time. So you can submit those as you leave the Zoom conference, or you can answer the follow-up email. And your answers will be shared with Dr. Mabuchi. So if you have any comments to make, please input those within the emails in the survey. Thank you very much for your time.